All right, so real quick, this ain't gonna be nothing fancy, but um, so listen to this, okay? Tell me this doesn't sound like Covey, okay? Now, before I go too far into it or whatever, start talking about the vaccine and hypotheticals. Listen to this. Diagnosis. When a person has experienced known or probable exposure to a high dose of radiation from an accident or attack, medical personnel take a number of steps to determine the absorbed radiation dose. This information is essential for determining how severe the illness is likely to be, which treatments to use, and whether a person is likely to survive. Information important for determining an absorbed dose includes known exposure. Details about distance from the source of radiation and duration of exposure can help provide a rough estimate of the severity of radiation sickness. Vomiting and other symptoms. The time between radiation exposure and the onset of vomiting is a fairly accurate screening tool to estimate absorbed radiation dose. The shorter the time before the onset of this sign, the higher the dose. The severity and timing of other signs and symptoms also may help medical personnel determine the absorbed dose. Blood tests. Frequent blood tests over several days enable medical personnel to look for drops in disease fighting white blood cells and abnormal changes in the DNA of blood cells. These factors indicate the degree of bone marrow damage, which is determined by the level of an absorbed dose. Dosimeter. A device called the dosimeter can measure the absorbed dose of radiation, but only if it was exposed to the same radiation event as the affected person. Survey meter. A device such as a Geiger counter can be used to survey people to determine the body location of radioactive particles. Type of radiation. A part of the larger emergency response to a radioactive accident or attack would include identifying the type of radiation exposure. This information would guide some decisions for treating people with radiation sickness. Treatment. The treatment goals for radiation sickness are to prevent further radioactive contamination, treat life-threatening injuries, such as from burns and trauma, reduce symptoms, and manage pain. Decontamination. Decontamination involves removing external radioactive particles. Removing clothing and shoes eliminates about 90% of external contamination. Gently washing with water and soap removes additional radiation particles from the skin. Decontamination prevents radioactive materials from spreading more. It also lowers the risk of internal contamination from inhalation. Hear that? Internal contamination from inhalation, ingestion, or open wounds. Treatment for damaged bone marrow. A protein called A protein called granulocyte colony stimulating factor, which promotes the growth of white blood cells, may counter the effect of radiation sickness on bone marrow. Treatment with this protein-based medication, which includes filgrastim, neopogen, sargramostim, leuking, and pegfilgrastim nullasta, may increase white blood cell production and help prevent subsequent infections. If you have severe damage to bone marrow, you may also receive transfusion of red blood cells or blood platelets. Treatment for internal contamination. Some treatments may reduce damage in internal organs caused by radioactive particles. Medical personnel would use these treatments only if you've been exposed to a specific type of radiation. These treatments include the following: potassium iodide, thyroshield losat. This is a non-radioactive form of iodine. Iodine is essential for proper thyroid function. If you're exposed to significant radiation, your thyroid will absorb radioactive iodine, radioiodine, just as it would other forms of iodine. The radioiodine is eventually cleared from the body in urine. If you take potassium iodide, it may fill vacancies in the thyroid and prevent the absorption of radioiodine. Potassium iodide isn't a cure-all and is most effective if taken within a day of exposure. Prussian blue, radiogardace. This type of dye binds to particles of radioactive elements known as cesium and thallium. The radioactive particles are then excreted in feces. This treatment speeds up the elimination of the radioactive particles and reduces the amount of radiation cells may absorb. Dithylene triamine pentacetic acid, DTPA. This substance binds to metals. DTPA binds to particles of the radioactive elements plutonium, americium, and curium. The radioactive particles pass out of the body in urine, thereby reducing the amount of radiation absorbed. Supportive treatment. If you have radiation sickness, you may receive additional medications or interventions to treat. Now, what does this sound like? This list right here. Bacterial infections, headache, fever, diarrhea, nausea and vomiting, dehydration, burns, sores, and ulcer. Exclude these two? What? This is the COVID right here. It's just my personal opinion. I think we're being cooked from the inside out slowly. And, and I don't know, to me, it would just, it would cause so many things, it makes a lot of sense to me. Into life care, a person who has absorbed very large doses of radiation has little chance of recovery. Depending on the severity of illness, death can occur within 2 days or 2 weeks. People with a lethal radiation dose will receive medications to control pain, nausea, vomiting, and diarrhea. They may also benefit from psychological or pastoral care. So, let's see. Like, how perfect of a bioweapon would that be, though? Concerning, this 5G thing. It's been out. It's been slowly rolling out for years now. And, hold on. Let me do something real quick to kind of explain my thought process. 5G. No, I don't need that. 5G towers, cactus tree. Alright, this is my thinking. Okay, if there's nothing sinister going on with the 5G, then why in the world are you trying to hide it in plain sight? I don't know. Just the more and more I look into it, the more I'm absolutely sure COVID is not even a real disease. It's, at this point, it's like a catch-all, But anyway, I wanted to share that because, this may be what we're going through. We are going through the 5G thing. And, I recommend looking a little deeper into the 5G and all the scientists that are against it and the petitions that are being tossed around to try to prevent it rolling out anymore. And there's some real concerns with the technology from very high-ranking people. And I just think how perfect how perfect would it have been or would be if, check it out, so you slowly roll it out over years, okay, and then into 2019, the beginning of 2020, you turn it on, you ramp it up, here we go with the test trial. I don't know, but I think it's awfully strange that the symptoms of radiation sickness and what they are calling COVID is nearly identical. I don't know. And then the mask, that would be even more sinister because the radiation poisoning keeps, let's see, where did it say it? but it keeps oxygen from being able to correctly form in the blood, right? So what do? You slap on a mask on your victims to make them catch even less oxygen, so we'll promote the decay of the body even faster. Just throwing it out there. I'm not claiming that's exactly what's going on, but I think it would be very hard to disprove that that's the case. So, I don't know. Question everything, yo. All right. Peace.